Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. And we appreciate you guys coming on. Thank you for that. And it's going to be Q&A today. So always fun. And let's say hello to a couple of friends before we get started this morning. There he is, number one on the hit parade. Brahim, Andrea pulling up a close second. And Lisa, how are you? Rosalinda, right up at the top. Elaine, St. John's, Newfoundland. Lucille, how are you? And Judy, New Brunswick, good morning to you. Kevin, there he is from sunny Oshawa. Nellie, how are you? Janice from Brampton, good morning to you. David from Ridgeway. Nativity, good morning. I guess they're getting some rain out in Portland, Oregon, and Brahim is happy. Hi, Fran, how are you? And Marianne from sunny London. Dennis from Norwich. And Donna from Newfoundland. Lorraine from British Columbia. See, guys, we go coast to coast. Douglas, how are you? Lynn from Aurora, Canada and the United States. Hi, Karen. Arlene and Patricia from Pulaski, Tennessee, and from St. Catharines, Ontario. Sandy, Vancouver, Washington. Hi, Gwen from Alberta. Grace from the Rock, Newfoundland. Paula Joe in Ohio. Cecilia, how are you? Helga and Dave from Scarborough. Denise, good morning from Oakville. Carol, West Virginia. Judy, Massey Drive in Newfoundland. Elaine, good morning. Milika and Arlene saying hello. Carol, Moncton, New Brunswick. Karen from Coldwater, good morning. And yeah, Brahim is saying, let's pray for Venezuela. Yeah, wow, did they ever get it? Leela, Beverly, those poor folks. Donna, saying hello to Arlene. Hi, Teresa. And Dunedin, Florida. Must be hot. Hi, Dave in Muskoka. Cheryl's in West Virginia. Sandy is in Fergus Falls. Sandy, you're usually up at the top. What happened? Elsie. Yeah. Okay, guys, let's get going here this morning. Can Dr. Martin speak about Conn's disease? Any insights or recommendations might have? And that's from Tracy. Well, Conn's is an autoimmune condition of the adrenal glands. Adrenal, on top of kidneys. When you have Conn's, you're secreting too much aldosterone. Look, it depends, Tracy, on a couple of things. First of all, every autoimmune that I've ever seen, I work inside out, meaning I start at the gut because, in my opinion, it always starts with the gut. When it comes to autoimmune, always leaky gut. Fix that. Now, do you have any symptoms of Conn's? Sometimes you just get diagnosed and you have no symptoms. Maybe let me know that, Tracy, because I don't want you fooling around with something if you're getting no symptoms of it. But definitely fix the leaky gut. Almost, like I said, with me, whenever I saw autoimmune, I saw leaky gut. Now, the fact that it's affecting your adrenals, because aldosterone, what it does, it regulates your sodium, potassium pump at the cellular level. So is that being affected? Do you actually have any symptoms of that? Because then I could guide you a little bit more. So maybe, Tracy, send me an additional email to info@martinclinic.com, and I'll try and answer you individually because I need to ask some questions. Are you getting any symptoms of it? Okay? Now, her friend, it wasn't even Tracy. Okay, my friend had been diagnosed based on lab results and waiting for adrenal CT scan. Yeah, okay. Give me some more info. I can help a little bit better answer. Okay, Gina, I do a 16-hour fast, but at 8 a.m., which is at 13 hours into it, I need to take a BP med, but I take my supplements, magnesium, DHA. Does this break my fast? No, it doesn't. Okay, it doesn't. You're still fasting. Okay? And look, there may be a few calories in the DHA, but that's not breaking your fast. Okay? If you take your medication, you're not breaking your fast. So, look, whenever I get people, this is just a general answer because I think it's really important. Guys, give yourself, and I used to do this in my office all the time. I used to send my patients home with a plan to succeed, not to fail. I always used to say, don't get into the weeds. If you want to do intermittent fasting, go 14 hours, better 14 than 12. If you stop eating at 6 o'clock at night, you go to 6 in the morning, that's 12 hours without eating, right? Now you can get past that, most people very easily. You're 8 o'clock in the morning, well, you're at 14. If you can go to 16 and you feel good, I like it, no problem. Okay? You're not breaking your fast if you drink water. You're not breaking your fast if you drink coffee. You're not breaking your fast if you take supplements or you have to take your medication. You're really not. If you want to get really uptight about it, because some people, it's religion. Like you can't, do anything. Like you can't even have a coffee. Yeah, you can. Okay? And I used to say, what's going to make this easier for you? Okay? Going to make it easier for you. Well, if I can have my coffee, then have your coffee. Okay? Even if you put a little cream in it, you're still not breaking your fast. Like I prefer you not do that, like no cream. But I'm just saying, guys, okay? You can be dogmatic or you can be, I want to succeed. Okay? So, I want you to keep it up, is what I mean. Okay, good question. Thank you for it. Let me see. Come on, let's get back to my questions here. Why are they not coming up? There they are. Okay. That was Gina. And Jacques, how many micrograms of K2 do we need with a vitamin D3 for the hammer? Well, the hammer is 3 days at 50,000. If you're taking ours, you already have the K2 perfectly. For every drop, you have the right micrograms of vitamin K2 in there. Okay? So, you don't even have to think about it. If you're taking 50 drops, because you're doing the hammer, you already got the right micrograms up in there. If you're taking a product just with vitamin D, then I'd have to do a calculation for you to take a separate vitamin K2. Why do that when you can get it in the perfect quantities in our vitamin D? I take the guesswork out, Jacques. Okay. Debbie, or Deb, Just been told my husband and I at age 75 and 77 need cataract surgery. Okay? We take 2 Navital, 4 to 6 DHA. The doctor said I got cataracts because we don't wear sunglasses. Oh. I got an instant migraine. It's instant. When I hear stupidity, I get a migraine. Okay? Cataracts don't come because you don't wear sunglasses. They might come because you do wear sunglasses. How do you like that? It would be just the opposite. But here's where cataracts come from. They come from a condition called glycation. Okay? Advanced glycated end products. You know what causes that? Sugar. Sugar. Not the sun. Okay? Oh, God loved that. What was it? What kind of a doctor was it? Or people are saying. Oh, it wasn't the doctor who said it. It's people who are saying it. I ought to read these things ahead of time, eh, Deb? That's not correct, okay? That is so silly. As a matter of fact, the newest research on sunglasses is, you know what it is? Don't wear them. Look, some people, I know most people do wear sunglasses, but at least in the morning, don't wear your sunglasses so you get melatonin coming in your eyes. Cataracts come from sugar. Sugar. That's where they come from. And sugar damages capillaries. Have a look in the back of your eyes. It's all blood supply. That's why I love Navital and DHA together. William, what percentage of fat in the brain is DHA? 60. About. Okay? Someone calls you fathead, William. Take it as a compliment. You love that fat, DHA. Yeah, your brain, your eyeballs too, by the way. There's a lot of DHA fat in your eyeballs. Isn't that wonderful? Okay? Why do I love DHA? I like EPA too, though. I just like DHA better because your brain is made up of DHA. And when you see Alzheimer's, when they do autopsies, or they don't even have to do an autopsy, they just have to do a scan, a brain scan. They see, you know what the brain does in Alzheimer's or dementia, especially the frontal lobe or whatever? Shrinks, shrinks, shrinks. Okay? It shrinks. You want to be called fathead. Healthy fat is DHA. Fat. Eat fat. That's why you love fat around your steak. That's why you like the fat in your eggs. That's why you like the fat in your good dairy. Okay? Fat is good for you. It's sugar that destroys. And those crappy fats, those oils that belong in your car, not in your body, okay? Those vegetable, so-called vegetable oils, bad. Okay. How they cook fast food, processed foods. Thanks, William. Brenda, I know Dr. Martin doesn't always like to tell people how much of any supplement to take. Yeah, like as an individual, I'm not in practice anymore. But if you ask me a question specifically, you know, generally I'll tell you how many to take. How many, let me see. Brenda, I should have, okay. How much ubiquinol would he take? The serving size on our bottle says, does it say 1 or 2? I can't even remember. 1 a day? I take 2. Okay? When people ask me how many I take for me, okay? I got people taking more than that. I have my older or patients that used to be in contact with me. I'll answer their questions if I can, and tell them how much I recommend. For example, I take 2 Navitol every day. Okay? Sometimes I take 4. I get a little seasonal allergy right now. Okay? It's ragweed. I do really well when I take 4 Navitol and 4 quercetin during this time of the year. Otherwise, I take 2 and 2. 2 Navitol, 2 quercetin. I take 2 ubiquinol, the CoQ10. I take 3 probiotics every day, 7 days a week. I take 4 DHA, high DHA, every day. Okay? That's what I do. Okay? So, thanks for the question, Brenda. Marissa. Why do some people bloat and some don't? Good question, Marissa. Very good question. Most times, okay, almost invariably, if you bloat, and you do apparently, right, Marissa? She bloats quite a bit. You have a condition almost invariably called SIFO. SIFO. It used to be called SIBO. Well, it still is. But it really shouldn't be SIBO. It should be SIFO. SIFO. Small intestine fungal overgrowth. I can tell you almost guaranteed, even without Marissa, hold on. Yeah, Marissa, even without knowing you personally, if you were in my office, I guarantee I would have found that you were full of candida, yeast, in the small intestine, fungal overgrowth. Might have been going on for years. Here's what you do. Broad spectrum probiotics. Our probiotics are, in my opinion, the best formulated probiotic there is. I haven't found one better, and I mean it. It's so popular. And then you need to be on our digestive enzymes because they're made for SIFO. We put oil of oregano in the digestive enzyme along with all of the other enzymes, broad spectrum enzymes, lipase, protease, and amylase. And because they're different strains of enzymes, we put the best in there to go after digestive issues, but especially for SIFO. Okay? Now, if you Google it, it'll probably say SIBO, small intestine bacterial overgrowth. Well, it's not a bacteria. A bacteria is there, but that's not the big issue. It's the fungus that's there. And ladies, I use this as example. When you get recurring bladder infections, it's not bacterial. Yes, bacteria is there. It's present. But the underlying problem in the lining of your bladder is not bacteria. It's fungal. It's a yeast. And then, of course, you take an antibiotic, and guess what? Kills all your good guys, and you get a growth. You get the Trojan horse that comes in. That's what happens in SIFO. Okay? So, fix. That was Marissa. Sahandra, I think. Chronic kidney disease, stage 3. Everyone says to cut out beef. I don't agree with that. Because what caused chronic kidney disease? Ask a diabetic. Okay, what causes kidneys to go south? What causes kidneys not to work? Insulin, sugar, not meat, sugar. And I understand why they say it, okay? Because oftentimes with stage 3 chronic kidney disease, okay, your glomerular filtration rate has descended. You're not filtering out. And oftentimes, too, they will check your albumin and you got protein in your urine. Well, protein in the urine means you're eating too much protein. No, it doesn't mean that. It means you're not clearing. You're not filtering out your toxins. That's how you get protein in the urine. It's not protein because you're eating too much. It isn't that. Doctors just said that 60, 70 years ago, and they never changed their mind because nobody taught them differently. So they just say, well, it's protein. You're eating too much. No, it's sugar. It destroys blood vessels. It destroys your filtration in your kidneys. Niagara Falls. Dehydration, that's a big issue with kidneys. Water constantly over your kidneys. Think of Niagara Falls. Flush. Okay? Flush. People don't flush. They flush the toilet, but they don't flush their kidneys because they're drinking everything but water. Water and only water filters out the kidneys. Plus, okay, coffee's good for your kidneys. And protein doesn't destroy your kidneys. You find protein in your urine, yes, but it's not because of protein that you're eating. It's actually a lack of it. That's who gets kidney disease. It's not people that eat a lot of protein. It's a people that eat a lot of sugar. It's a fact. Okay? It's a fact. And good luck trying to change your doctor's mind. It's how they got trained. It's so difficult. They don't read enough about nutrition. They should be listening to this program. Tell your doctor to listen. He might say, well, Dr. Martin's a quack, but I know what I'm talking about. When it comes to food. Okay. Elaine says, doctor diagnosed me with vitamin D toxicity. Okay. I've been experiencing a range of symptoms, including fatigue, nausea, lightheadedness, dizziness, constipation, diarrhea, burning sensation in my back and neck, difficulty walking. Listen, first of all, Elaine, you got a lot of symptoms, a lot of different symptoms. Whenever I saw vitamin D toxicity, which did I ever see it? Maybe once. Elaine, I gotta tell you, I am very reluctant to agree with your doctor. Okay, now you got high vitamin D levels, so don't take vitamin D right now. Get vitamin D from the sun. But Elaine, let me ask you a few questions, and then please send them into the answers into me, okay? Because I got so many questions. Number one, how long have you been unwell like this? Okay? How long? That's really important. Okay? Did it happen in the last few weeks? And then you got blood tests, and then the doctor said you had vitamin D toxicity? Okay? I need to know that because I can't answer your question. Okay? Without knowing some of your history. Please give it to me. And you got a lot of symptoms. Is this recent? Or has this been going on for a long time? What is your history? Give me some history of how you've been feeling. You're feeling really good, and then now I feel really bad, and the doctor said I got vitamin D toxicity. I guess it's possible. I just got to tell you, in 50 years of practice, did I ever see it? I can't even think of a case. What I did see is the opposite, is a lack of vitamin D. And you guys know that because I talk about it every day. So Elaine, is it possible? Yeah, I guess it's possible, but I need to know more because I'm skeptical. Okay? I'm skeptical that that diagnosis is right. Okay? You got way too many symptoms, first of all. But second of all, I need to know, did this happen overnight? Because if it's vitamin D toxicity, you'd be unwell. Well, how long have you had 530? Is that Canadian or American numbers? You got to give me that too. Okay? But that's high for sure. But is it toxic? Well, I'll tell you, there's a lot of people maybe even on the scroll this morning would tell you my numbers are around there, and that doesn't bother me at all. And somebody else is saying, Sharon is saying, yeah, you should be taking vitamin D with K2. That I agree with. Okay. But Elaine, give me some more information. Okay? Maxine, Dr. Martin, what causes burning mouth symptoms? Usually, okay, this is not always the case. Burning mouth is usually low cellular levels of B12. Usually. Low cellular levels. At the cellular level, your B12 is low. You're not absorbing B12 properly. And when you get paresthesia, and you get burning mouth syndrome, a lot of times with neuropathy, it's low B12. I've seen that 1,000 times or more. Okay. And she'd been given pain medication. Yeah, no fun having burning mouth syndrome. Okay. But generally that's what I found. Okay. Sue, arrowroot powder, is it okay when on low carb diet? Why are you taking that? You mean arrowroot cookies? Arrowroot powder. What? No. Do you want to take it? Well, there'd be carbs in there. It'd be very low carb, just the powder. Don't they use that as sort of a thickening agent? I would ask you, Sue, why are you taking arrowroot powder? Okay? But it's relative. Just the powder on its own would be pretty low carb if you want to take it. I want to know why you're taking it. I'm a why guy. Why are you taking it? If you don't mind answering me, I'd be happy to get that answer from you. Send me an email. Elaine, are the oil of oregano soft gels, 1,500 milligrams, as good as taking the drops? Yeah, they're pretty good. Like we put oil of oregano in our digestive enzyme. They're great. Any way you want to take it. I like the drops myself. Guys, our oil of oregano, we searched the world for that. the best of the best. The most bioavailable oil of oregano, professional strength, doctor tested oil of oregano. I like the drops because I can put it on my toothbrush. I can use it on my skin. I can, I like what Kevin was saying the other day. Put a little bit on the Q-tip, and you can put the Q-tip a little bit and, sniff the oil of oregano. I love that. Okay? Gargle with it for a sore throat. A few drops. But, hey, I like the capsules. I got no problem with them, Elaine. Okay? Carol, does coffee... Carol, I'm going to get a migraine. I'm going to get one. Carol's asking, does coffee raise cortisol? Nope. It don't. Okay? You're not going to get me, Carol. Okay? You're not going to get me to admit that there's anything bad about coffee. Okay? You won't get me to do it. Why? Am I lying to you? No. Am I biased? Yeah, I'm biased. But I'm telling you, there is nobody in the universe that has talked more about the benefits of coffee for the last 50 years. Nobody has talked more about the benefits of coffee than me. I have named it the real vitamin C. And the more they study coffee, the more the research agrees with moi. Me. I've been saying it. You guys know this. Some of you out there have been following me for over 30 years. Some of you out there have been my patients for 50 years. Some of you. What have I said about coffee from the get-go? The same. When everybody said it's no good, it's a diuretic, it'll affect your adrenals, it's bad, it's acidic, it's bad. I said they don't know what they are talking about. Coffee is a gift from God. It is the most powerful antioxidant. It is 1,000 times more powerful than ascorbic acid, vitamin C. Do you need vitamin C? Yeah. But you don't need it to supplement it. Coffee is so broad spectrum. It affects everything in a good way. So there you go. I will not back down. I won't. Because I'm right. It does not, you got adrenal problems, don't drink coffee. That's silly. Now, you might not want to have a decaf. I know a lot of people, the way they operate, they got to drink decaf. I know for me, I can have my beautiful coffee in the morning, and then after lunch, if I have a coffee, and if I like a coffee at night, I have a decaf. I have to. And it happened when I turned 50 years old, almost on the date. Because I used to be able to drink coffee before I went to bed. It didn't bother me. But now, if I have a coffee that's not decaffeinated, I can't do it. Even after lunch, I find. I'm an old goat. Okay? I'm an old goat. I gotta drink decaf in the PM. That's me. Okay? I had a neighbor friend. Oh, yeah, I can drink coffee. I said, yeah, how old are you? I'm 48. Wait till you're 50. It was almost like on his birthday. He said, you know what? I can't drink I got to drink a decaf. But decaf is good for you. It's the bean. It's the bean that's good for you. It's a gift. Enjoy. And it's a lot better than tea for you teetotalers. Okay. Why don't we quit today? We got to do this Monday too. Yeah. Okay. We're going to do it Monday. Okay. Did we have fun today? Well, I was having fun. Okay. And guys, I'm very opinionated, but I don't care by telling you that that's my experience. Okay? I didn't get this gray hair for nothing. Okay? And I don't have much of it left. Experience. And I got to tell you what to do and what not to do. And I don't mind being opinionated about it. And when someone starts attacking coffee, I feel like I got to defend it. Because I know a lot of gurus that they don't know what they're talking about. But I'm telling you, the research is incredible. Okay? Incredible on coffee. Okay, good. Okay, guys. We love you dearly and sincerely. And looking forward to a good week next week. Okay? If you got any more questions, don't be shy. Send them in. We'll talk about them. Okay? Sometimes I got to ask you to send me more info. Because I need that info to give you the proper answer. But you don't know that until you ask. So, anyway. We love you guys. Talk to you soon.